Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Ayim, triple board certified cosmetic surgeon and OBGYN. Let's get polished. All right, guys, let's talk about fat, the fat advantage, the aesthetic power of fat grafting. What if you've spent years of your life thinking that get rid of fat is the solution? You just want to get rid of the fat wherever you don't like. And I am here to tell you that fat is an aesthetic tool. We use fat tremendously to accomplish some phenomenal, fantastic results. So your fat that you're trying to get rid of might not be something you want to get rid of. You might want to just transfer it somewhere else. This episode, we're going to talk about fat grafting and the advantage of it. For decades, aesthetic medicine honestly taught people to think that fat is literally exclusively something you get rid of and you throw it away, and that's it. We diet it away, we exercise it away, we liposuction it away. We basically just get rid of fat. But as a cosmetic surgeon, I want you to think of fat a little bit differently. I find it most interesting that sometimes I don't want to throw away fat. Actually, I want to keep it, restore it, and put it somewhere else, right? I want to just move it from one body area to another. And let's get into the detail of how beautiful this aesthetic surgery can be for you and the advantages it has. Because simply put, fat is about proportion. A lot of times you want the fat gone because you're not satisfied with where it is and what it's doing for you. So proportionality is what you're trying to accomplish when you want to get rid of fat. And I'm here to tell you this, my friend. Sometimes the problem is not excessive. Sometimes the problem is just deficiency. Deficiency of fat in certain areas that needs to be fixed or addressed. And sometimes the best aesthetic results comes from just doing both at the same time. Get rid of the excess, fix the deficiency, and voila, you have a problem that is resolved. So let's talk about autologous fat grafting. What that essentially means is that you take your own fat from your body and move it from one area to another area. So that is what autologous fat grafting is. It's very strategic in how we do it in the placement. And because the tissue comes from your body, that is the same person, is autologous. That's why it's called autologous fat transfer. No, your husband, your wife, your sister, your brother, your good girlfriend cannot donate the fat to you. There's a process for that, and that is not autologous fat transfer, okay? Now, let's move to the next thing. Today, what I really want you to do is stop thinking of fat as something we simply remove. I want you to embrace the idea of start thinking of it as an aesthetic material. It's a tool. It is something essential that can give you some amazing results and outcome, all right? So first off, fat isn't just fat. Okay, there's established science behind fat to give us the benefits of it and how amazing it can be for you and things you need. You need to understand fat is a living tissue. It's a tissue organ that is living, it's alive, and when it's moved from one place to another, it is alive, it's not dead. And so when we perform fat grafting, for example, we're not just injecting artificial fat. We're literally taking a living tissue that is harvested from your body and is processed, go through sterile processing, and it is carefully transferred to another anatomical area to give you the results that you want. And another word, fat grafting, is transplantation, kind of like hair transplant, fat transplant. You can think of it as that. So the most important thing is fat retention, right? Because I get a lot of questions from my patients that ask me, how much fat is it going to stay? How much is it going to stick? Because if we transfer this much volume, is it all going to still be there or what's up? And that's the science behind the fat. Research has reported wide ranges of fat survival. I mean, the range is wide. I'm talking about from 30% to 80%. So as a surgeon, I can only tell you that there's this range of survival. You are going to have some depletion of the fat that is transferred. How much percentage? A surgeon cannot tell you exactly because research shows that it's a wide variety of range. But what we can tell you as a surgeon is that you will have a decline of the quantity of fat that is transferred to the area that you want over time, and then it starts picking back up. So it's kind of like a dip to rise. Alrighty? So when my patients are asking me that, obviously I cannot give you a very clear, exact percentage answer. It's just that range. So overall, the technique matters in the fat grafting, and the technique will help improve survival and outcome. What do I mean by that? The technique, we're looking at harvesting technique, processing technique, injection technique, recipient technique, vascularity of the tissue around there, patient-owned biology is so important, smoking, weight changes. All those things are going to affect the fat tick, all right? Literature, on the other hand, is very supportive of us saying that we cannot give you a percentage, but we can tell that there will be some fat that takes when it's transferred. Let's put an important myth to rest, okay? If it's your own fat, it's completely risk-free. That is not necessarily true. Just because we're taking your own fat from one place to another doesn't mean it's risk-free. It is, however, biocompatible. So it is biocompatible because it's your own fat. So in that sense, it's risk-free. But complication, no, it's not risk-free because depending where the fat is placed, there are some potential risk and complications that can come from there. What are the complications? Infection, asymmetry, fat necrosis, oil cyst, calcification, contour abnormalities or irregularities, and obviously the most fatal one, which we talk about, serious vascular complication or injury that can cause serious fatal complication, depending where the fat is placed. So let's just talk about the incredible versatility of fat and how it can actually be used. I mean, I personally love fat. I use fat in my office for so many different reasons and so many different places. So we're going to talk about where you can use fat. Let's start with the very obvious one, your face. All right. Facial procedures that depend on fat really give some nice, beautiful results. If you look at your baby pictures, like remember when you're in your 20s or teens, and you look at your face, it's so nice and full and voluptuous. Your cheekbones are high and up. Your temple is full. You just have this full baby face is what we call it, right? As we age, some of it shrinks and your cheekbone becomes more noticeable, your temple sunkens. And as you're aging, a lot of things change in your face. So one of it is volume depletion. And the biggest misunderstanding with facial aging is that you get wrinkles. That is not necessarily the case. Not everyone is going to get wrinkles like that. But one thing is for sure, volume redistribution does occur to everyone. You will have some shifting of fat, some redistribution of that fat, and the volume is going to be affected. That is a fact. And the reason why that's happening is because you have ligaments changes on your face, your bony structure changes as well, and even your dentition changes as well. So you have your skin changes, your ligament changes, your bone changes, and all those things is going to affect your volume, your volumization of your face as you age. So this is where fat comes in as the hero. It can help restore some of the volume that you have. And the good thing about fat as opposed to fillers is it's more longer lasting. Now, the percentage of take, again, is varied from what research has shown us. So overall, the research into facial aging is enormous. There's so many literature out there that show us the recognition of volume loss and redistribution and how facial fat actually helps complete the aging phase in such a beautiful way. And there's no need for me to go deep into those articles. There's several. All right. The important thing with facial rejuvenation, in my opinion, is that just we need to restore the architecture as natural as possible. Try to get our patients back to feeling and looking like themselves. Nothing exaggeration. At least that's my take as a cosmetic surgeon. I don't think you need to be exaggeratory with those things, but a very subtle, soft, natural results is what I think you should be going for. So what areas of your face can you address with fat? Well, you have your temple. Your temples right here. You can have fat transportation there, and that will help fill the temple, because as we age, that really shows a lot. And, your mid-face, just your cheek to your upper lips, you can use fat there to help with your cheekbook, augment that mid-face and give you that fullness and just lift everything up. And you know what? It's probably one of the most powerful indication for facial fat grafting, the mid-face, that is. And, it really helps a lot. And in my opinion, chasing fillers, especially in the nasal labial folds and the mid-face, I think a fat grafting is a better option than using the fillers. But what do I know? And then you also have your periorbital region. Your periorbital regions around your eyes, where you can help restore volume due to the aging phase, and sometimes it's medically related. And you know what? This is one of the most unforgiving part of our face is our eyes, because when you're talking to someone, they're looking at you, they're making eye contact. So you want to really enhance that area the best that you can. Then you also have your lower face, which we can use fat grafting as well. Your lower face is essentially from your mouth down to your chin. And in that area, you can use fat grafting to give you a broader jawline if you want, a more angulated jawline, But the important thing is that a good facial rejuvenation technique should not make anyone look so filled. Like, have you seen some patients, you can just tell they had something done and it looks overdone? That, I feel, should not be your goal. You want to make it as you as possible without drawing the unnecessary attention to who you are. Because you're going to draw attention, but you want the good one, right? You want the one that's looking at you and say, hey, you look amazing. Or what have you done? What is your secret? That's what you want, that type of attention. And, all of that, in my opinion, is just part of pro-aging, because we don't want to stop aging. We just want to enhance it. We want to embrace it, and we want to make it as ours as possible when we're doing all these changes. Now, let's talk about fat versus filler, because they are both tools to help with volumization, but they're not the same tool. Really important. You don't swap one over another. And honestly, if I can put filler in the face, why should I harvest fat? That's what I get a lot from patients. Like, just put filler and I'm done. You don't need to put fat. Well, let's talk about the advantages of filler, and also let's talk about the advantages of fat so that you can compare the two. What is the filler advantage? Well, it's quick, office-based, predictable quantity, little or no donor site injury or recovery from a donor site. Certain hyaluronic acid fillers can be dissolved if needed. So those are your advantages of filler to the face. Let's talk about fat advantages, right? It is also your own tissue. So if you use fat, it's your own tissue. It's not a foreign object or agent, I should say. You can use large amount of fat to accomplish your results, and it can treat broader areas. Filler has its limitation, whereas fat is more diverse. All right. So surviving grafting maybe provide more of a, in my opinion, durability of the person. So a filler and a fat, they both do the same thing. They do volume optimization, and they have their advantages. I always like to discuss that with the patient, but I think fat is one of those things that doesn't get as much love for the reasons that filler is everywhere, and everyone is doing filler, and not everyone can do fat transfer. So fat, in my opinion, sometimes is less predictable on instance when it's done. So, the patient has to deal with recovery from the harvesting site. They have to deal with swelling, sometimes, just reabsorption issue when you've transferred the fat. And sometimes revision might be there, cause some nuances with that, okay? But honestly, filler is an opinion, is an option, it's not a controversial medicine or anything like that. And so there are indications for it in certain areas that have FDA clearance. The important thing is, this is not about team fat or team filler at all. That's not where I'm going with this conversation. It's just that good aesthetic medicine allows you to choose between a fat or a filler, and we know the right tool for the right anatomy to give you the results. That's where I'm going with this. And that's it. So let's talk about fat transfer to the breast because, again, fat advantage is awesome. You can use it on the breast for so many reasons. It's not a substitution, in my opinion, for implants or a lift or a reduction that needs a lift. It's not. But in the right anatomy, in the right case, it can be a great addition. So the reasons why I think fat in the breast isn't good is because unlike the face, when sometimes the results is in millimeters, in the breast, you can use the larger volume to achieve the results that the patient is desiring. So it becomes more of like an aesthetic tool and a reconstructive tool, depending the reasons for why she wants the fat transfer to the breast. And the important thing is just, you want to have subdural application and changes in the upper pole and just help with symmetry if that's what her concern is. Sometimes she may have contour irregularities that fat transfer can easily take care of. Sometimes they just want a better cleavage. So augmenting along those lines will help with the cleavage and the dresses. And also sometimes it just helps with implant positioning, but that one you have to be very careful because we don't need an implant injury. The most important thing I feel with fat augmentation is that setting the patient expectation is very important. You cannot promise a patient sun, moon, and stars because fat grafting has this limitation. It's not an implant, so you cannot expect to get like this very large breast with fat transfer, So setting the expectation is important. And fat grafting is not replacing implant. That I think is cornerstone in that expectation, okay? So we also have to worry about graft survival in the breast, just like I mentioned with the face. Sometimes the fat doesn't take as well, and over time it may kind of dwindle down. What are the risks of breast transfer using fat? Or I should say fat transfer to the breast using fat. What are the risks? Fat necrosis, oil cyst, calcification infection, loss of absorption or transfer, and irregularities can also be a complication. And then, maybe patient might need more surgeries to fix the transfer. So fat grafting is widely used to help refine the breast, whether it's in reconstructive surgery, correct contour defects, or improve soft tissue handling. So it's an option. It's another location that we can do fat as a transplant. So that's part of the fat advantage. Now let's talk about another area, all right? We're going to talk about the hips and the buttocks. You can absolutely use fat in your hip dips or in your buttocks. And whenever you hear the word buttocks, you immediately think in BBL, right? Like pump a lot of fat, make the buttocks so large so I can get a BBL butt. That might not be the case. Let's break it down into different areas of the gluteal anatomy that you can get fat transfer to get the results you want, right? I've mentioned the hip dips. Also, you can do the lateral hip deficiency, the upper pole fullness. Fat can be placed there to fix that defect. It can be placed in the buttock right at the projection to give you more of a projection if that's something you want. It can help with asymmetry in case the buttocks is not, symmetric. And it can also just help transition the waist, the hips, the buttocks. That transition can be a nice silhouette, and that's what fat transfer can be very helpful for. The most important thing is just the safety, understanding the safety that comes with fat transfer to the buttocks, because unfortunately, there are complications. And in this case, a complication can be very severe, like pulmonary embolism, which comes from fat transfer. So in that case, there are some suggestions, depending which states you are, and recommendation that whenever you do fat transfer to the buttocks, you use ultrasound guidance. The idea with that is that the ultrasound allows you to see where the cannula is placed, and you want to place the cannula above the muscle within the subcutaneous tissue to do your transfer. That's going to avoid all the major vessels and avoid any complications. So that's where ultrasound comes in handy. Some states require it, some other states do not. It's still not a substitution for good technique from the surgeon and being careful and understanding your plane where you're injecting the fat. And when done correctly, I'm telling you, it can be very beautiful, all right? But however, a beautiful result that compromises safety is not a beautiful result, in my opinion. And more is not automatically better when it comes to fat transfer to the buttock. It's all about proportion. It's all about objective presentation that gives it a nice silhouette. And so we just don't do volume for volume's sake, right? But, there's some patients out there that want it big, big, and really big, like big as Texas. And that's your prerogative. But finding a surgeon that will give you that is very important, because a lot of surgeons, I think, are now becoming very conservative in their approach and how they're handling BBL. Now, let's talk about some other areas that you can have fat advantage or you can use fat for. A very easy one is your hands. As we age, we're so focused on our face, our neck, our décolletage. We don't really talk about our arms, at the back of our hands. That is part of aging, because when you start taking care of your hair or doing something, you see your hands in the mirror. And if you look very carefully, you're going to notice that your skin is thinner. The tendons become more visible to eyes, even your veins become more prominent, and then the underlying volume is just gone. So you can use fat in your hands to help restore that youthful appearance. And if it's done correctly, the results can be so nice. I mean, I'm talking about the soft tissue and the skeleton prominence can be reduced. The wrinkling and the thinning of the skin can be reduced and improved. And you know what? The results can really be so nice and beautiful. So if you spend a lot of money doing rejuvenation to your face, your neck, you should definitely consider the back of your hands as part of that rejuvenation protocol. One of the things I do personally, whenever I rub like some products on my face and especially like sunscreen, whatever is left, obviously I take it to my neck, my décolletage, and then I know both of my hands were used to rub on my face. I rub each back of my hands with the product. So that's something subtle, but it's helpful to improve your hands. Another area that fat can be used as an advantage is contour irregularities. I'm talking about anywhere in the body. If you feel like there's a depression or dip somewhere, you can literally take fat from one place and put it there and give you fullness and volume optimization. If you have scars or reconstructive defects, fat can be placed in that area to help with the results. Now, let's talk about fat and regeneration, because it's one of those things where you hear about regenerative medicine so much, peptides, growth hormones, or growth factors, etc. And then there's fat, because fat is part of that regenerative medicine, right? It's important to say that for us to know that you hear people talk about regenerative medicine in the context of stem cell growth factors, regeneration, skin quality, nano-fat, stem cell facelift. This is a lot of marketing and medicine kind of mixed together. So it's very important to kind of know what is the medicine and what is marketing, because they're not going to give you the same thing. As I mentioned earlier, fat is a living tissue. However, adipose tissue does not contain adipose-derived stroma or stem cells populations and other biologically active components, all right? It is used in a regenerative field space, and there's a lot of research going on in there to give us some really good research. However, it's very important to distinguish between promising biology and a miraculous cure to a patient's regenerative concerns. So that fine line between medicine and marketing is so important when it comes to that. The important thing is volume restoration has been established with fat transfer, and that anyone can speak on very confidently. Finally, so who's a good candidate? Who is a good candidate for fat transfer, right? As a cosmetic surgeon, it's more than just looking at someone that has fat and say, oh, you're a candidate for fat transfer. There are so many things I'm thinking about when I'm looking at that patient and seeing if they're a good candidate. Some of the things I'm looking at is donor site availability. Yes, you might have a volume depletion in one area, but where am I going to take the fat to replace it? And is it a good fat in that particular area to replace the concern? I also look at recipient anatomy. Your anatomy is going to determine if this is possible or not. Sometimes it really isn't. And I will be the first one to tell my patient, nah, let's not do this. It's not good for you. So your anatomy is important, what I look for, the skin quality, because, honestly, if a patient has severe laxicity and has very little fat to be removed from the donor site to place in the area of concern, I'm not going to waste her time, because that fat is not going to make a significant change with what they want. And that all goes with that patient expectation, right? So skin quality is something I look at. The expectation of the patient is something I look and I match it to what can be done in such a way that give them a great result. Overall, they're at good health. I want a patient that's healthy. I don't think that, not that you should not do cosmetic procedures, but if you're generally not in good health and you have so many other things going on, my general recommendation is to wait. Take care of all those things, get the appropriate clearance, make sure you are good before we proceed. Always the standard of care. Some of the things that are red flag that I'll tell a patient, oh, let's wait. Smoking, your smoking status. We do know smoking affects your vasculature, so we don't want to put you in a disadvantage. So before we start, how about we get the body right? We stop smoking. So that is important. Weight stability is important because if you're on a weight loss journey and you've not reached your target goal and you're gradually still losing weight, it's best to wait before you do fat transfer because the results is going to be altered with your weight loss journey. Prior surgery is something I look at, ask from patients because it may impact my decision to want to proceed with fat transfer. And also, I just look at overall degree of correction that is needed. Does it match what I can do? And sometimes it cannot, and I'm very truthful and very honest with patient. My bottom line, or the bottom line, is to understand that transfer of fat behaves like fat. What does that mean? It's a very simple concept. If you gain weight, okay, after fat transfer, wherever the fat is transferred, you may have more fat in that area. Possibly. Likewise, if you lose weight drastically, there's a very fair chance that you're going to lose fat in that area as well. So fat is going to behave like fat. You don't know what's going to happen with you fluctuating with your weight. So it's always good to keep that in mind. Before I conclude, there are 5 things I want you to keep in mind when it comes to the advantage of fat in your body. 5 things. Very rapid fire. And I'm just going to go through all of them, okay? Number 1, fat is not just something we remove. It is an aesthetic and reconstructive tool. Number 2, fat grafting is about proportion, not simply volume. Number 3, not every transfer of fat cell survives. So results aren't mathematically predictable or guaranteed. Number 4, the best treatment may be fat, filler, implant, surgery, or a combination of all of that. And number 5, technique and anatomy matter enormously because fat grafting is real surgery with real risk. And of course, there are benefits to it. So let's just talk about this. Beauty isn't about making every part bigger, smaller, tighter, younger. Good aesthetic medicine, good aesthetic surgery, in my opinion, is about understanding proportion, knowing what to remove, what to preserve, and sometimes what to push back or to put back. You got to know all 3, right? Because it's a moving part. So the next time you hear someone say, I just want all the fat gone. Remember, in aesthetic medicine or surgery, one person's unwanted fat is actually a raw material for somebody else wanting that fat to restore balance somewhere else. Or it could be you too. So before you say, I just want this fat gone, look everywhere else in your body. Maybe you want that fat gone in that one area. We can take it and put somewhere else and give you results that you're satisfactory. All right? And just because sometimes the art isn't in like taking away the fat, in my opinion. The art is about moving the fat and maybe just removing the fat in that area and giving the illusion that you've had more fat placed somewhere else. What I mean by that is that sometimes when I do a really good lipo on the lower back, a patient that was contemplating wanting to have a BBL procedure or fat transfer to a buttock, she may just have a better projection of her buttocks where she doesn't need a fat transfer. So sometimes it's just fixing one area really well that will give the illusion of what you want on the other side, okay? So that, all of what I just said is the fat advantage. So you have to know that fat is advantageous to you, and there are places that it can be moved from one to another and give you fantastic results.
I hope you enjoyed this episode and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polish Beauty Podcast or at Dr. Daisy Ayim. Remember, a new episode drop every Wednesday, so stay tuned. Please like, share, follow.